Hi, my name's Dr. Shri Datta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'd like to talk about what a normal period is and also what heavy periods and painful periods can mean. So firstly, what exactly are normal periods? Well, most women experience periods on a monthly basis, so round about every 28 days or so, and they tend to last about 7 days in total. It's not unusual during that time to experience some degree of pain or bloating, and also periods tend to be heavier in the first 2 or 3 days. So what exactly are heavy periods? Well, these tend to be periods that last for longer than 7 days or are heavier than you naturally expect them to be. So for example, if you usually wear a sanitary towel and you're changing them every 3 or 4 hours, you may have to change that more frequently, or in fact wear tampons as well as sanitary towels. Some women experience flooding, which means that they experience blood on their clothes despite wearing sanitary towels and tampons. As you can imagine, that can be really quite disruptive to your lifestyle, and in the longer term, it can leave you quite drained and feeling quite tired. So these are the women that we see who come to us about heavy periods and heavy menstrual bleeding. So the things we're looking out for include pathology like fibroids, which is muscle tissue that grows within the womb itself, or in fact polyps, which are little tiny portions of tissue again within the womb. So these are factors that we want to investigate and to treat. And the treatment of heavy periods really depends on the actual cause, as you can imagine. So in some cases, it may be appropriate using medication. It can be as simple as that. And in other cases, it may be better to think about surgery and removing items such as fibroids if they're causing you a problem. Now, lots of people have got fibroids. They don't always cause heavy bleeding or problems, so it's really important to be aware of them. But I think it's better to present sooner rather than later if you've noticed a change in your period. And I guess the question to be asking is whether your periods are affecting your lifestyle. Now, I've mentioned fibroids and polyps, but there are, of course, other causes of heavy periods. And the things we're looking out for are whether your thyroid function is normal, so if your thyroid gland, which is located in your neck, is working normally, or in fact, there's a clotting disorder in your blood. So as well as requesting things like an ultrasound, we may also need to look at blood tests. And treatment really depends on what we find as being the cause for your heavy periods. So as I said earlier, it may be as simple as correcting an underactive thyroid gland or considering the contraceptive pill. But in other cases, surgery may be a better option. The good news is that in most cases, we're able to treat heavy periods very effectively. Okay, so now let's talk about painful periods. Well, it's normal to have a degree of pain with periods, particularly in the first day or so. And often women say that they need regular pain relief. That can be ibuprofen or paracetamol to get through the cramp-like pains that they experience. So when does it become abnormal? Well, if you're finding that you're on regular medication during your period, throughout your period, or in fact it's impacting on your lifestyle, it might be time to come to us and see us for a review. What kind of things are we looking at? Well, there can be problems within your womb, such as endometriosis, which is where the womb lining deposits elsewhere outside the womb itself. So these are the types of problems that we would like to investigate. There may also be an infection in your womb, and we can do tests to exclude whether this is a problem or not. Now, I also mentioned fibroids earlier in relation to heavy periods, but fibroids can also cause painful periods. So again, having an ultrasound can help diagnosis. And if that's the case of your period pain, then we can look at treatments for fibroids. So, just to recap, today we've spoken about what normal periods are, what can be the cause of heavy periods and what we can do about them, and of course, what painful periods are, and again, various treatments for those. My name's Dr. Shri Datta, and I hope this has been very helpful to you.